Welcome, everyone, to our White House virtual town hall, primary care providers, health systems, and the next phase of the vaccination rollout. My name is Bishara Shukair, and I serve as the White House Vaccinations Coordinator. Sitting next to me in South Court Studio here at the White House is the Surgeon General of the United States, Dr. Vivek Murthy. And sitting on the screens here, we have Dr. Rochelle Walensky, Director of the CDC, Dr. Marcela Nunez-Smith, Senior Advisor to the White House COVID Response Team on Equity, and Dr. Anthony Fauci, Director of the National Institute of Allergy and Infectious Diseases. And on the other screen, you'll see doctors and nurses from around the country who are joining us. On behalf of all of us from the Biden administration, I want to take a moment to thank you for joining and thank you for all the tireless work over the course of this pandemic. As a family physician myself, I know firsthand how critical the role of providers is when it comes to getting more and more people vaccinated, particularly those who still have questions about the vaccine and are not 100% sure they want to get vaccinated. I have an enormous appreciation for your work and sacrifice. Providers have been and will continue to play an essential role in this vaccine rollout. You are the most trusted source of vaccine information for your patients and for your communities. And your offices are the most preferred location to get COVID vaccines. So today we're going to have 5 conversations on the role of primary care providers and health systems in the vaccination effort. First, Dr. Murthy on the role of primary care providers in vaccine education and countering misinformation. Second, Dr. Walensky on health systems and improving vaccine confidence and access. Third, Dr. Fauci on providers and increasing adolescent vaccination. Fourth, Dr. Nunez-Smith on providers and vaccine equity. And fifth, I'll be talking about the health department's role in ensuring that primary care offices have access to the vaccine. So with that, I'll turn over to the Surgeon General of the United States, Dr. Vivek Murthy.
Well, thank you so much, Bishara, for that kind introduction. And a big thank you to all of you who are joining us here today at the White House for this National Town Hall. My name is Vivek Murthy, and I have the privilege of serving as U.S. Surgeon General. And I want to echo Bishara's thanks to each and every one of you, primary care clinicians, health professionals, and health systems leaders, as well as our state and local health officials. All of you have played an extraordinarily important role in getting us to today. And as the country and as the world have battled COVID-19, I know that many of you have been on the front lines, in clinics and hospitals and health departments. I know that you've answered frantic patient calls when a COVID test came back positive. You've taken a hard look at the data and made tough decisions on behalf of your communities. Many of you have suited up in protective gear and PPE, sometimes not nearly enough of it, and have raced to save lives. And you did all of this knowing that at times you were putting yourself at risk, the risk of getting sick, of being flooded with angry calls and protests because of your decisions. And of course, there is a risk to your mental health and emotional well-being. But in the midst of all of this sorrow and fatigue, you've continued to show up day after day. And for that, for all that you have done to keep our nation safe, we owe you an immeasurable debt of gratitude for your sacrifice and your service. You've helped your patients, families, and entire communities navigate a year of extraordinary uncertainty and very painful loss. But because of you, we now see signs of hope. Over 172 million people in our country have been vaccinated with at least 1 dose. And deaths from COVID-19 are at their lowest point since March 2020. We've come so far, but we've got more ground to cover if we want to vaccinate the millions more who need protection from COVID and its consequences. Now, to reach that goal, we know we need to work together, and that's why the government has been working to knock down these barriers for your patients and your communities, from free rides to the vaccination sites, to making it easier for employers to give their employees time off from work to get vaccinated, to also providing free childcare. All of this while continuing to spread the word that the COVID-19 vaccines are free to anyone, regardless of their insurance status. And there's more we want to do to support you, including steps taken by Medicare this week to increase financial support for COVID-19 vaccines that are administered at home. So today, we want to call upon one another as clinicians to reaffirm our role in this final stretch of the pandemic. We want to ask, what can each of us do to help people get vaccinated? For some of us, that means calling your patients and asking them if they've been vaccinated and then helping answer questions they may have. Surveys tell us that 8 in 10 adults turn to their doctors when deciding whether to get a COVID-19 vaccine. That means that your voice really does matter. For others of us, getting involved may mean going to your community and speaking with your local school, with your faith community, or visiting your local YMCA or Boys and Girls Club to talk with parents and adolescents and community members about the vaccine. And for others of us, getting involved may mean reaching out to your family and friends in order to empower people to make decisions that they feel comfortable with. So today, we're here to talk about all of that and more, to start a conversation, if you will, a broader movement in the weeks ahead that will lead up to what we hope will be a resounding success on July 4th. But to be clear, this effort will continue well beyond that. Now, I'm so grateful to speak with all of you today because not only do I think of you as colleagues, but I know that you are all part of a sacred lineage of healers who for generations have stepped up to face the challenges that their communities have faced, from smallpox and yellow fever to polio and now COVID-19. And our purpose as healers has never been more clear. So with your partnership, I know that our country can emerge from this dark year. I know that we will find brighter days ahead. Thank you so much again for being with us. And it gives me great pleasure to start with our first panel. Our first panel is going to focus on primary care providers. And I'm really blessed to have the opportunity here to have 3 wonderful clinicians with us. Dr. Basim Khan, who's a primary care physician and executive director at Neighborhood Health in Virginia. Dr. Kohar Jones, who is a primary care physician in Chicago, who cares primarily for the homeless. And Ms. Edie Pacheco Galloway, who provides care for patients primarily focused on cardiovascular health in Tucson, Arizona. So to all of you, thank you so much for joining us today. Kohar, Basim, Edie, I really appreciate you being with us. I want to start, let me start with Basim. And, and I want to, I've spoken to each of you and I know just how much you have to offer. And in the limited time we have, though, I want you to share some of the pearls that you have gleaned from your own experience. And Dr. Khan, I'm hoping you can talk to us a bit about your own conversations with patients, as well as your efforts to reach out to your panel of patients. Tell us what that experience has been like and what have you learned that you think would be helpful to clinicians listening today?
Thank you so much, Dr. Murthy, for inviting all of us and for your efforts throughout this pandemic. For me as a primary care clinician at a community health center, one of the lessons that I've learned over the years, but especially when it comes to COVID vaccines, is not to make any assumptions about where our patients are, how much they know about the vaccine, what their opinions are about the vaccine, or their willingness to act upon the advice that we give them. And it's always great to have open-ended conversations where you try to learn where they're coming from and you try to listen so that then you can offer advice. In terms of reaching out to our patient panel, as many of the people joining us know, there's so many different ways to do that. It's proactive outreach through text messaging, through letters, through phone calls, as well as taking every opportunity when a patient comes in the office to talk to them and engage with them about the vaccine. And probably the biggest lesson that I've learned there is the importance of motivating and engaging with our staff. Because like you mentioned so well, it's been a difficult few months for a lot of people in healthcare. There's a lot of burnout. We've called upon them to do so much. And now in primary care, we're doing that again by asking them to take such an active role in the vaccine effort. There are no easy answers to this, but any thought or effort that can be given to motivate staff, to encourage them, to engage them, to elevate champions, and make them own the process And to recognize their hard work, I think goes a long way, because ultimately it's in all these one-on-one interactions where a difference is going to be made, and they have to be motivated to do that.
Absolutely, absolutely. Well, that's very helpful. And Dr. Jones, I want to bring you in here as well, because I know when you and I spoke, that you mentioned a few things that really stuck in my head. One was the importance of planting seeds with patients, not necessarily knowing when those seeds will come to fruition, if you will. But I would love if you could talk a little bit about your experience planting some of those seeds in your conversations with patients. And then I'd also love for you to mention a little bit about some of the community work that you are both doing and that you've seen in schools that are examples of how doctors can help expand the vaccination effort in their communities.
So I've made the COVID-19 vaccine question one of my routine primary care questions. Have you gotten the COVID vaccine yet? Yes. Thank you for taking care of yourself and the community. No. Why not? And just letting them answer why yes, why no, and being able to answer the questions and letting them know, even if they don't get it that day, I'll keep on asking them. And they can, situations change and how they feel change, and to create the expectation that there's an opportunity for choice anytime that they come in. So really emphasizing the possibility to choose. I work with Heartland Alliance Health, which provides healthcare for the homeless. So we've had the opportunity to do really close work with the Chicago Department of Public Health, reaching participants where they're at in the shelters. Mary Tornaveni has led the organization in coordinating nurse teams and community health worker teams to go into the shelters and to do it ahead of the actual vaccine event, to connect with the shelter leads and then connect with shelter participants, answering whatever questions they have, with over 50% uptake in the shelter participants, which is fantastic. Within the clinic, Melissa Salgado-Bellin has done an amazing job of supporting providers and encouraging us to ask every participant. And then I've seen in my son's preschool, the Kiva Schechter, the health committee, with the pediatricians, Dana Shinazi and Elishiva Shanes, leading the health committee, holding vaccine town halls, answering parent questions, and creating a norm of this is what we do to take care of each other so that we're able to continue to have our children in school and to maintain this community together.
Well, I mean, what you just mentioned is really powerful, and I want to underscore 2 points. One is what you're doing by asking every patient is so important, because success isn't necessarily somebody saying at the end of a conversation, okay, I'll take the vaccine. It might be them starting the thought process. And I know that you and many other clinicians have had the experience of having that conversation, then a week or two later, the patient may contact you and say, okay, I decided to get vaccinated. So you just never know when giving people permission to have that conversation, to think openly about the issue, may end up changing their mind later.
I absolutely had that experience, which was so gratifying. Yeah. No, I don't want it. My family wants me to have it. I'm choosing not to have it, validating the choice, having him come back a month later for lab follow-up saying, I went, I got the Pfizer, I went the day after, I trust you. It was really exciting.
That's amazing. That's so great to hear. And that's what can happen in clinics all across America if we do this together. Ms. Galloway, I want to bring you in here as well, because I know that you have been doing some really important work in Tucson, Arizona with the Medical Reserve Corps. And I'd love if you could share a little bit about the MRC, what it is, what you're doing with the MRC, and help people who may be listening around the country and thinking, hey, I'd like to do that too, how they can get in touch with their local MRC.
So the Medical Reserve Corps is an organization where you can register your name, your profession, and be called to help in a state of emergency and situations. So I personally had signed up for the Medical Reserve Corps several years ago, but never had an opportunity to come in to do anything with the Medical Reserve Corps. But in Tucson, I signed myself up. I had signed up a couple of friends, nursing friends, and my sister, who has been kind of my tag team person. We have signed up for several clinics throughout town. The Pima County Health Department is doing a fantastic job. Dr. Teresa Cullen, hats off to the Pima County Department for doing such a fantastic job throughout the entire town of Tucson, Arizona. We've been going to homes. We've been going and hitting areas where are highly populated with Hispanic populations, and getting the word out and getting people vaccinated, at their grocery store, at their place of worship. And it's easy for folks to do that when it's just right around the corner, or if they see folks that are that they know have gotten the vaccine or are in line for the vaccine. It's easier for them to go ahead and get that vaccine for themselves and their families.
Well, that is exciting to hear, and I'm glad you found your local Medical Reserve Corps, MRC. For all those who are thinking, gosh, I'd love to engage in an opportunity like that, there are MRC units all across the country. And so, just engaging and contacting your local MRC might present opportunities for you to get involved in some of those volunteer efforts. Dr. Khan, I want to come back to you about this point of community engagement, because I think that for many people who might be thinking about helping with the vaccine effort outside their office, they might initially think, gosh, well, if I can't go on TV and if I can't figure out how to write out beds, then how am I really going to help inform the public? But as all three of you have showed, there are many ways to do that. But I'm curious, what would you say to clinicians out there who are looking for ways to get started in engaging with their community about the vaccine?
I would say two things. First of all, your voice is so important. Your community and people want to hear from you. And the second thing I would say is just find some way to get involved or some opportunity to get involved. It could be at your own place of worship. It could be at your children's school. It can be through any other avenue that you think makes sense and that's easily accessible. They would love to hear from you. We did a lot of work with a whole bunch of community partners to reach underserved populations. And in addition to providing the vaccine, what many of our partners asked for was, could you or one of your doctors or one of your clinicians come and speak to us, come and speak to the members of our church. These were done virtually. And there was a lot of interest in that because people just want to hear from us. There tends to be trust when there's a physician or a clinician in the same community talking to them. So all I would say is, get involved and people want to hear from you, and each effort does count. It does make an impact.
Yeah, and I want to underscore the local part of what you just said, the power of local voices, because it can be easy sometimes to think that people who are in national or state level positions are the ones who have disproportionate impact. But in this day and age, when people are just absolutely inundated with information, it is all of you who know patients, who have relationships in communities, who have the power to really reach people where they are. In the last couple of minutes that we have here, I want to just, Dr. Jones, come back to you about one specific topic, which is time. One of the scarce resources that clinicians have is time. And many people might wonder, gosh, how am I going to ask all my patients about whether they've been vaccinated? Isn't this going to eat up many, many hours in my day? So I'd love if you could just say a couple words about how much time has it taken you to have those conversations, and how have you managed those time demands?
It's an interesting question. I might not be the most timely provider, so I may not be the one to answer, but I just wrap it into the preventive care visits and preventive care. Have you gotten your colonoscopy? When's your pap smear due? Have you gotten your COVID vaccine? And then answering questions as they arise. A lot of my education is as simple as there's a lot of misinformation out there. The sources that I trust all show that it's okay, that it's safe. When I got it, all I felt was a little bit of soreness in my arm. And then that's what I hear from most of my patients, and then moving forward from there.
Wonderful. And Ms. Galloway, we'll give you the last word here on the panel. But as you've gone to door to door to meet people across Tucson and to talk to them about the vaccine, I think one other thing that people may worry about is they may think, gosh, will people think I'm intruding on them if I'm going to talk to them about this vaccine? But how have you been received when you've approached people and tried to start a conversation about COVID-19 vaccines?
I actually think that people have been receiving you with open arms. You know, when you go to them and you care enough to go to their doorsteps and to talk to them about the vaccine. But I also really think that it's very important that if, we have a Spanish-speaking patients, that you speak to these patients in their primary languages. So, I do speak Spanish, I'm fluent in Spanish, and I think that, in speaking to patients with, in that situation, they really tend to trust you a lot more. I always share experiences of myself, like, Dr. Jones had said, and then also bring in my dad's experience, who's 85 years old, and the type of vaccine that he's received and his, how he's felt after the first and second vaccine. Very helpful when you talk to patients in that manner.
Wonderful, I appreciate that. Well, I so appreciate all of the insights that all of you have shared. You've made it real, what it's like to actually do this work in your offices and your communities. And I think if I could just summarize a few key points, I think one is make asking about the vaccine part of your routine, recognizing that your voice has extraordinary power just by starting the conversation. Number two, reach out to your panel of patients, whether it's through text message or email means or putting up signs in your office to remind people to get the vaccine. That makes a difference. And the third is to find simple ways to start conversations in your community. Maybe it's at your child's school, where you take 10 minutes at the PTA meeting. Maybe it's in your faith group, as part of a regular service. Maybe it's through other organizations like the MRC. But however you do it, one thing we know for certain is that your engagement, your voice here is absolutely important and is going to be a key part of getting us to success with this national vaccine effort. So thank you all so much for joining us today. I deeply appreciate your time. And I'm going to turn it over now to Dr. Walensky, the director of the CDC, who will be leading a conversation on health systems. Dr. Walensky?
Thank you, Dr. Murthy. Before I accepted the honor of leading CDC, I served as the chief of the Division of Infectious Diseases at Massachusetts General Hospital. And I very much remember that moment when my pager went off on March 6th, 2020. It was a Friday morning, alerting me that we had our first case of COVID-19 in our hospital and in our lab, and really how everything changed after that. Our hospital was quickly overtaken by the COVID-19 pandemic, and as we worked frantically, I was constantly thinking through how we were going to reach our underserved communities, how we were going to incorporate evidence-based guidance into our treatment, and how we would eventually deliver vaccines. There's no doubt that healthcare professionals and the health systems they work in have been particularly hard hit during this pandemic. I know, and the data reflect, the healthcare professionals are the most trusted source of information on vaccines for both patients and for parents. And as one of the first groups to get vaccine, when supplies were very limited, healthcare professionals and healthcare systems led the way with COVID-19 vaccination. And now that more vaccines are more available, including smaller packages for Pfizer that we've worked into getting out into pediatric and primary care offices, healthcare providers and healthcare systems are once again leading the way as they educate and encourage all of their patients to get vaccinated, from patients they see in the emergency departments to adolescents coming in for wellness checks. Health systems, including hospitals and medical groups, play a critical role in vaccine access, confidence, and equity. Health systems have unique resources, have unique reach, and a level of trust to leverage in this effort. And many health systems and associations have efforts already underway to contribute to the next phase of the vaccination effort. So I'm really grateful to them for those efforts. One example is the American Medical Group Association reached out to its members to take action between now and Independence Day These efforts included proactively educating and reaching out to patients, as we just heard about, partnering with community organizations, serving as a public vaccine ambassador, again, recurrent themes, encouraging healthcare colleagues to get the vaccine. And within 36 hours of sending the request, 105 AMGA medical groups and health systems representing 74,000 physicians and 750 employees who care for 53 million patients committed to this effort. We also know that many hospitals are implementing best practices, and we thank them for that as well, and encourage all hospitals around the country to take up these efforts. These efforts include, but are not limited to, vaccinations upon discharge from the hospital, vaccinations at emergency departments, distributing shots to hospital-affiliated primary care providers, encouraging hospitals to ramp up pop-up clinics, redoubling efforts on hospital staff vaccine uptake. CDC has shared the following guidance just this last week to assist with these efforts, and that's called Increasing Access to Vaccination Opportunities, COVID-19 vaccination upon discharge from hospitals, emergency departments, and urgent care facilities. So with that, I have the great pleasure of introducing two panelists today, Dr. Mark Rosenberg, who's the president of the American College of Emergency Physicians and chair emeritus of the emergency medicine at St. Joseph's Health in Paterson, New Jersey, and Dr. Andrew Beidman, who's the executive vice president and chief medical officer of Kaiser Permanente. So with that, I'd like to start with Dr. Rosenberg, if you would. Dr. Rosenberg, can you tell us about St. Joseph's efforts to provide vaccinations upon discharge from your emergency departments? These are complex settings. How were you able to make that work?
Well, thanks for having me, and I'm excited to tell you a little bit about St. Joseph's Health and this initiative and the results of the initiative. Have to know a little bit about St. Joseph's Health. It is a mission-driven healthcare system in northern New Jersey dedicated to providing health equity to its entire community. And this is evidenced by the fact that St. Joe's had a community-focused pandemic response. And it can't happen without the support of every level of the hospital and the organization. So this all started at the C-suite with our CEO, Kevin Slavin, our chief medical officer, Dr. Joe Duffy, who allowed the staff in the emergency department and throughout the hospital to provide innovative, direct care to everybody in the community that needed it. The ED became an integral part of the care. Part of the concern was that many people in Paterson, New Jersey, came to the emergency department in part for primary care. So we started giving shots in the emergency department for discharged patients, and we used a single shot. We used the J&J vaccine because it made things so much easier to accomplish without as much follow-up. Of course, we'd always try transition to care initiatives to get them back to their primary care doc. Not only did we do this in the emergency department, but we looked at those communities that were underserved by zip code. And we put together vaccine efforts to not only take care of patients in those communities that were underserved with whatever it would take, but with centers or mobile vehicles, but also at home or nursing homes if that was necessary. The results of this program are absolutely unbelievable. All in all, almost 80,000 shots were given to date. This data is from yesterday. The person in charge of this vaccine program was Linda Reed, who made it all possible for this to happen in the emergency department and in the community. But when I spoke with her yesterday before when I was planning to be here today, I said, "What's your secret sauce?" And we said it multiple times today. And she says, "It takes a village." And that's what we had. So just an amazing effort, and so proud to be here to talk about this. Thank you, Dr. Lewinsky.
Thank you so much, Dr. Rosenberg. Dr. Beidman, on Tuesday, June 8th, as part of the National Month of Action, Kaiser Permanente announced a new patient vaccine outreach effort. Can you tell us about it, and how are you able to make it work?
Well, Dr. Walensky, thank you so much for the opportunity to be here with you today. And let me just start by saying how pleased I am to see the steps you've been taking to restore scientific integrity at the CDC. Kaiser Permanente has been really pleased to be a part of the National Month of Action sprint to vaccinate 70% of adults in the United States against COVID-19 with at least one shot by July 4th. And as an integrated delivery system, Kaiser Permanente has been able to leverage our sophisticated electronic health record, digital tools, and coordinated efforts across our care continuum to create patient-centric strategies to increase the number of vaccinated members and in the public. With our scale and extensive experience in population health, Kaiser Permanente aims to boost vaccine confidence with a multi-pronged approach, really to try to reach targeted populations. For example, we use our electronic record system to identify and reach out to eligible but unvaccinated people. And we do this using culturally relevant emails, mailings, and text to encourage vaccination. Messages are tailored to individuals and populations and use a variety of messengers, including our providers, as we talked about in the last sessions. We use our employees who reflect the people in their community. And then when our patients and our members come into the office, what we do is we make sure that physicians are prompted to discuss vaccination in a personalized venue. We use that same electronic health record to batch the emails and secure messages so that a primary care physician can send out those messages to their own patient panel. And we particularly target this to high vaccine hesitant communities where we believe that personalized touch can really make a difference. And we have been piloting using text in addition to email because we think that maybe just by clicking on a link in a text, it might reach some people who might not otherwise be responsive. Another thing we've been doing is that when patients come to our facilities, including our pharmacies and our labs, we have posters conveniently located throughout our facilities with QR codes that basically allow individuals to access our vaccine clinics and see immediately where they can come in and get a vaccine on a walk-in basis. So we're trying to make it as easy as possible to get a vaccine. And we're also doing a lot of work in the communities where we are. So as part of the National Month of Action Sprint, we launched a robust acceleration plan beginning June 4th that's included an additional $10 million in community grants that we've provided to 100 community-based organizations to promote vaccine confidence messages and engage organizations such as churches, schools, and other trusted community hubs. This $10 million is on top of an investment we had already made of $25 million in nearly 200 community-based organizations to increase vaccine access and build confidence in high-risk populations. We've also created something we call the Immunity, with an emphasis on unity sweepstakes. It's open to anyone age 12 or older who's been vaccinated by Kaiser Permanente or all vaccinated Kaiser Permanente members, regardless of where they got vaccinated. And this sweepstakes basically encourages vaccination while also supporting a full and healthy return to life's activities. We have 1,000 people who will be reward winners, and these will include things like wellness retreats, healthy home meal deliveries, personal training equipment, gym memberships, and family trips to theme parks and national parks. And in the community, we're really relying on the use of social media campaigns with influencers that are relevant for those communities. So we're reaching out to particularly 18 to 30-year-olds through these campaigns, delivering relevant messages from trusted voices and social influencers. We're doing this also with existing partners, including the Cloud9 esports organization. Finally, I just want to point out that we've created a toolkit at Kaiser Permanente that we have made available publicly. It's available on our website, and it's focused on improving vaccine access and equity and trying to highlight really some of the approaches that we think have worked in our own setting. In that toolkit, we identify 7 archetypes among the population eligible to be vaccinated, ranging from vaccine advocates to some steadfast opponents. And we try to provide concrete tactics for reaching each of those groups. And as I said, it's available on our website, and we hope it will be used by others and will be found to be helpful as we try to contribute to this dialogue as you're doing here today to really reach as many people as possible.
Great. Thank you to you both. I think what this discussion really highlights is how each setting may be unique and that there's so much extraordinary work that can be done in each. Dr. Rosenberg telling us 80,000 people who were reached and through a really complex setting like the emergency departments, but using a simple to use vaccine, the J&J, that really only requires 1 dose, really having equity at the focus. And then also, Dr. Beinman, your ability to leverage digital tools to do outreach and make sure that you're doing that outreach that's tailored to individuals, as well as incentive programs. So many lessons that we can learn as we take this and moving forward. But building on all of this, I would just like to encourage all health systems to reach out to as many patients as you can and in any different way that you can, to make sure we learn the lesson from Dr. Rosenberg, to engage all stakeholders. If you want to do this in the emergency department, you do need to reach out to your C-suite and get help. Work with community-based organizations on expanding vaccine access in vulnerable communities. Sign up to vaccinate at your group or practice if you haven't already, and then encourage healthcare employee colleagues to get the vaccine themselves if they haven't already. So thank you for this discussion. Thank you so much, Dr. Rosenberg and Dr. Beinman, for these important lessons you're teaching us. And now I will pass things over to Dr. Fauci.
Thank you very much, Dr. Walensky. I have the real pleasure to welcome and have a discussion with Dr. Lee Beers, who's a neighbor here in Washington, D.C., a pediatrician and a president of the American Academy of Pediatrics and a professor of pediatrics and the medical director for the community health and advocacy at Children's National Hospital. And our focus today is how we can increase COVID-19 vaccine uptake among a very important group, namely adolescents. To set the stage, let us look at some data on COVID-19 in children in the United States. So far, there have been more than 3.3 million COVID-19 cases and 314 deaths in people younger than 18 years of age, according to the CDC. The CDC recently published data on COVID-19 adolescent hospitalization rates. The rates, thankfully, were very low, about 2 per 100,000 at their peak. However, among hospitalized adolescents, nearly 1/3 required admission to an intensive care unit, and 5% required invasive mechanical ventilation. And about 30% of these children had no underlying conditions that were recognizable. You've all heard of the multisystem inflammatory syndrome in children, MIS-C. So far, there have been more than 4,000 cases reported to the CDC. And in a recent paper in the New England Journal of Medicine, reporting on MIS-C cases in 26 states, 73% had previously been healthy children. Long COVID has also been seen in adolescents and other younger patients. So I'm going to be talking to Dr. Beers and asking her about her experience in this regard. The bottom line is that COVID-19 in pediatric patients, although rare with regard to serious complications, definitely can be very serious. And the good news is that COVID-19 vaccine have proven to be very safe and effective, including in younger people. The Pfizer vaccine is already approved for people ages 12 and older. In a large clinical trial, that vaccine had 100% efficacy in adolescents 12 to 15. Similar results were reported with Moderna vaccine, who yesterday, June 10th, applied to the FDA for emergency use authorization for adolescents 12 to 17 years. And so we made some good progress in vaccinating adolescents. 23.4% for children aged 12 to 15, and 38.6% of children aged 16 to 17 years have received at least one dose of vaccine. The Biden administration has worked to improve adolescent vaccine uptake, such as with webinars and listening sessions, with pediatric education and other adolescent-focused associations following FDA authorization and ACIP recommendation. But clearly, more needs to be done. And actually, that's what we're going to talk about with Dr. Beers. So welcome, Dr. Beers. It's great to see you. It's great to be with you. It's a real pleasure. So let me ask you, as a pediatrician who talks with other pediatricians all over the country about their experience, what are the most compelling reasons for adolescents to get vaccinated? And in this regard, what have you seen with long COVID and other serious sequelae in adolescents?
Well, thank you so much for that. And really just echoing the thanks others have shared for your partnership and for the administration's partnership. We're really honored to be here with you today. And it's such an important question, and it's one that we hear a lot, right? And in my mind, there's really three key issues that compel me to recommend vaccine for adolescents. And in fact, given my own adolescents, their vaccines, I have a 12 and 16-year-old at home. So, and I think three key things. First is that, as you just pointed out, vaccine, COVID infection in children and adolescents really is not benign. I think we've been very grateful that children don't seem to be impacted by the infectious complications of COVID to the same degree as adults, but they are still impacted and they can still get quite ill. And if we have a safe and effective vaccine to prevent that, we absolutely want to do that. I think the second reason is, the other impacts of COVID, the other impacts of the pandemic have really had a disproportionate impact on the children of our country. They've borne so much of this for us. Their school's been disrupted, their sports, their activities, their friendships, their social networks have been disrupted. And getting vaccinated is a really important way to get everyone back to that. There was a study released just today, actually, that there was an increase in suicidal attempts over the past year for young women, teenage women presenting to the emergency department. And so this is very real. And I think the third thing, and actually this is one of the things I hear from my kids and their friends, is that there's a sense of community obligation and service in getting the vaccine. I think our young people know that when they get vaccinated, they're helping to decrease the spread of COVID within the community. And that, I think, is a really important thing. And you also asked about long COVID, and I think, you know this better than anybody. We don't, there's lots we still don't know about COVID. And when I talk to pediatricians across the country, you mentioned, I just have this great honor, and I really to be able to represent over 60,000 pediatricians across the country. And what I hear from them is that they are seeing kids in their practice every day, every week, who have had COVID and who are having lingering symptoms. And I think we're still getting our arms around the data on that. But what I'm hearing from pediatricians across the country is that's a very real thing, and that kids are having prolonged symptoms. And just one more reminder how important it is to really be protecting our young people and vaccinating them with the safe and effective vaccine as it's available.
Well, thank you for that really, really wonderful answer. I'm very impressed by the aspect, Dr. Beers, that we talk about a lot. And it's good to hear from you about your children, your two teenagers, about their appreciation for the community responsibility. Because, we talk to them about the fact that indeed, as I've mentioned, we can get children can get seriously ill, even though the incidence of that occurring compared to the elderly, for example, is much less. It still can be serious, but the idea that your children realize the communal importance of it. So how did that conversation go? Just to give people an idea, did they come to you and say, Mom, we'd like to get vaccinated? Did you nudge them a little bit and say, by the way, should you get vaccinated? How does the conversation go? I've had 3 teenage girls a long time ago. They're no longer teenage. And I'm kind of wondering how that would go today if they were teenagers. So how did the conversation start?
Well, that's a good question. My kids may be in a unique situation, so maybe I'll tell you about my kids and then also what their friends are saying too. My husband is also a pediatrician, and with this role and work from home, I think my kids have overheard more about COVID and the COVID vaccine than probably most adolescents their age. So I think they started with a good baseline knowledge, but I will tell you, they came to me. It actually started. Well, I would say it started with a conversation even before the vaccine was available to any of us. And my 16-year-old said, Mom, are there any vaccine trials near us? I'd like to be in a vaccine trial. And so that led to some additional conversations. And they both, when the vaccine was available, they said, when can you sign us up? My son is 12, and so he was more recently available, and he's been counting the days until the day he's fully vaccinated. So I think they're really enthusiastic about it. But when I talk to my patients or to friends or others who have kids who aren't growing up in a household where we're talking about this all the time, I think a lot of it is about getting back to the things they used to do, getting back to full in-person school and getting back to sports and being with your friends. And lots of the questions my daughter asks are, okay, Mom, can we go to a movie theater now? Can we take, can I go on the metro? Can we, so a lot of it is really about getting back to the things that they love to do and that they want to do without worry and without hesitation.
Terrific. Well, let's go to the other side of that coin, Dr. Beers, and that has to do with vaccine hesitancy. One of the things that we are concerned about, obviously, is that there is a degree of vaccine hesitancy that we have to address. And in interactions with patients and their families that you have, do you often encounter vaccine hesitancy? And what are some of the concerns that parents and maybe even the children have, for example, in your clinic and in your practice? Could you tell us a little bit about that?
Yeah, absolutely. And I think, you're very right. And just as with adults, adolescents have vaccine hesitancy and parents have vaccine hesitancy for their kids. And I think, there's a couple different groups, I would say almost. There are parents and teens who just have questions that they need to have answered. They're sort of on the fence and they think they might want to do it, but they're not sure. They've heard just, conflicting information and they want the opportunity to ask some questions. And I think those are, some of the panelists earlier talked about how just having those conversations in your practice are so important to really reaching families who may just have a few questions. I think there are other families who have more specific questions. I think some of the most common things I hear are concerns about, how the speed of which the vaccine became available or whether or not we have enough experience with it in kids. And I think, those are things we're able to talk through and again, answer those questions very honestly and transparently. And I think the general public knows more about the vaccine development process than ever before in probably any of our lifetimes. And then I think there's this whole other bucket of misinformation. And that in some ways, sometimes that's easier to deal with, sometimes that's harder, right? And so I think, some of the misinformation that's out there about, vaccines causing infertility or other things that we just know aren't true. And so really, again, I think maybe it was Dr. Jones earlier said, I just ask patients, what are their questions? What have they heard? And so asking about those things and then talking through, why we're not worried about those things without, of course, reinforcing the misinformation. We have to be careful to do that too. And I think, unfortunately, social media is powerful, and there's a lot of misinformation on social media, and our adolescents are on social media a whole lot. And so they see the good stuff, but they also see the misinformation there.
Great. So I have time for one last question that I have to ask you. Since you are the president of the American Academy of Pediatrics, could you just tell us what are some of the initiatives that the AAP and Children's Hospital are involved in?
Thank you for that. I would love to. I think vaccines in general is something that pediatricians have been doing for a long time, and so we thought about this a lot. And when the COVID vaccine came up and came available for adolescents, we were really ready to jump in. So I would say a couple things that I'd love to highlight. The American Academy of Pediatrics has a campaign called "Call Your Pediatrician" for parents. We've got fun PSAs and social media tags and articles on our healthychildren.org website that you can push out and really encourage parents to call their pediatricians, both for questions about the COVID vaccine, but also, get back in for your well visit and get caught up on your other routine immunizations as well. Some of the things I'd love to highlight and our work at Children's National, actually a really terrific partnership that we had with DC Public Schools. And we partnered together with DC Public Schools actually before the vaccine was authorized in adolescents, because we really wanted to make sure the teachers were vaccinated and felt comfortable going back to school. And so we partnered with them, went down to Dunbar High School here in DC and had a couple really big days where we brought teachers in to help them get immunized. And I tell you, it was just, I was down there, lots of my colleagues were down there, and it was just one of the most joyful things that we had done all year. And it was really, really a special opportunity.
Terrific, wonderful. Well, one of the things that we talk about a lot in our medical response team, particularly among the community core concept, is trusted messengers. And without a doubt, your physician, your family physician is a trusted messenger. And among those, clearly pediatricians rank very high among them. So keep up your great work. We really do need what you all are doing. So thank you very much, Dr. Beers. It's a real pleasure speaking with you. And now let me just turn it over now to Dr. Marcela Nunez-Smith.
Great. Thank you so much, Dr. Fauci, and good day to everyone. Thanks so much for joining, and so appreciate what each one of you is really doing, in your practices, in your organizations, just to get the entire country vaccinated. I'm so looking forward to my conversation today with Dr. Kanini Rodney, who's the Deputy Associate Chief of Staff at the Birmingham VA. And we're gonna talk some about equity, which everyone has mentioned, because we know it needs to be at the center. So I'm just gonna take a couple moments for reflection and then launch into discussion with Dr. Rodney. And as I look around here, I think we all feel that urgency when it comes to equity, that we know we have to find those solutions. We're hearing about them today that will work for every community. We have to have everyone benefiting. At this time, the vaccine is the best tool that we have in our toolbox. Certainly for the Biden-Harris administration, centering equity in the COVID-19 response and recovery has been top of priority. And I know that's shared. The reality, and we know it all too well in this past year, and we've known it for decades and beyond, when we're in a time of national crisis, it is all too predictable every time which groups will be hit the first and hit the hardest. And for many communities, Black and Brown communities, other communities of color, for rural communities, for many other groups, people with disabilities, those in the LGBTQ plus family, and yet others, these groups are all overrepresented in the burden of COVID-19. So cases and hospitalizations, and tragically in death and loss of life. Yet underrepresented when it comes time to benefit from scientific discovery, be it testing or therapies, and of course, today's conversation, vaccination. We have to acknowledge the social realities, the structural drivers, really the limited access to resources and opportunity over generation that play such a key role in this. And also to acknowledge the earned distrust, quite frankly, of medical institutions and the government. So these are just some of the unique considerations in the equity space. And while we acknowledge them, we have to address them. And so my gratitude is deep. Everyone is doing so much now to advance equity in this moment. We cannot let up. It's going to take the creativity, the innovation that we're hearing about. It's going to be hyper-local. For sure, we have to bring vaccine to people. We have to do it in partnership, collaborations, the investment of our time. People have all talked about that. We have to connect everyone with information, as well as making sure vaccination is just easy, and convenient. And identifying and removing all of the potential structural barriers, things like making sure there's paid time off, transportation, and childcare, just priorities, and always meeting people where they are. Forum like this just cannot be replaced. This opportunity to share with one another, now we're practicing internal medicine physician as well, what's working, also where we see persistent challenges and just try to solve for them together. So I'm so looking forward to these next moments in conversation with you, Dr. Rodney, because your leadership has been just tremendous in this space. You know, you're a board certified internal medicine physician in leadership at the Birmingham VA. You are also Women's Health Medical Director, and so relevant to today's conversation. You're leading the COVID-19 vaccine initiative there, and you've got the key responsibility for operations and outreach. So lots to learn from you today, to learn with you today. So welcome, Dr. Rodney.
Thank you so much, Dr. Nunez-Smith, for the warm introduction and for inviting me to participate in this conversation today. And I want to thank you for your extraordinary work that you've been doing all along, as well as what you're doing with the White House COVID-19 response team. So again, thank you for having me. I think everyone has played a role and has to play a role in stemming the COVID-19 pandemic. And I'm honored that my executive leadership at the Birmingham VA chose me to lead our efforts there, our local efforts. Our VA serves a diverse population of over 68,000 veterans. And our veterans are spread out with over 24 counties across Alabama, the northern and central areas of Alabama. And so it's a diverse population in terms of ethnicity, in terms of geographic location. And so that also makes it a challenge in terms of planning out strategies that will affect all of those populations. So we started really fairly early in December by vaccinating first our employees, and then we went to our quickly moved to our high-risk population. And by January, we realized that we were running out of space. And so used an off-site location where we were easily vaccinating 500 to 1,000 people a day. And one day we even reached 1,100, and that was very exciting for us and very exciting for the team to have accomplished that. And while we were doing that, we were also training and preparing our outpatient locations to take on that challenge as well, our rural located clinical community outpatient clinics. So we invested in planning early, but we also knew that we had to take action very quickly.
Absolutely. And I think what we need to get into is, I think, a reality that you probably have faced in Birmingham. We certainly have seen it in the federal vaccination channels, that those who were most eager got vaccinated kind of first and as soon as they could. And I think we anticipated that. That's reflected in that kind of hitting 1,100 in a day, as you mentioned. So we know it's going to take a little bit more intention in this next phase to reach everyone. Can you talk for a bit about how your vaccine efforts, both operations and outreach, have really evolved or changed since those first early days and the inception?
Yeah, I mean, I think like most of the healthcare systems, the challenges they're facing right now, we moved from a highly centralized, high volume approach to now using a far more decentralized, low volume clinics across our catchment areas. And that may involve pop-up clinics in collaboration with local community agencies and community organizations. And our outreach also has shifted, right? It's shifted from being broad global messages to what others have mentioned in the panel discussions already, to targeted intentional efforts. And we used every single modality that was at our disposal. So whether it was mail or email, text messages, print media, social media, through health fairs. And then most importantly, we use the voice of our veterans. So those who had been vaccinated, using their voices to help other veterans to get vaccinated. And then the voice of our providers, as we're talking about today. So those are the kinds of shifts that we have to make. And I'd say the biggest overarching change is that our philosophy and strategies move from providing a single product, which is the vaccine, to providing a service. So one that requires building trust, capitalizing on relationships, and removing barriers so that the veterans feel safe and confident about getting their vaccines in their local communities. And so we've opened up access to to veterans' spouses, caregivers, and as mentioned before, also to adolescents 12 to 17 years old as well.
That's really fantastic. So with that, and I think that that's exactly the kind of creativity and change of frame, right? Thinking about providing a service. Let me ask you specifically about how you're reaching out to those groups that really traditionally have been marginalized, have been medically underserved, have had difficulty accessing healthcare services. What have you been able to do there?
Yeah, so we have been closely monitoring our efforts all along. So it was pretty easy for us to identify our high-risk populations and those with lower vaccine rates. And just as we did with our outreach efforts, we really cast a very wide net, right? Because our strategies had to be, we thought, multi-pronged, and we had to do them simultaneously in order to get to the various pockets of underserved and underrepresented. And our strategies range from overcoming issues with access to evidence-based information, as others have talked about, and addressing vaccine concerns, to overcoming things like mobility and transportation and other socioeconomic barriers. And it has meant working closely with our community partners and local agencies and having individual or small group conversations to meet veterans where they are in the vaccine spectrum, and working with them to move from vaccine hesitancy to deliberation, to acceptance, and then to action. I think other panelists have talked about that as well. I can give you some specific examples of some of the groups that we focused on, keeping in mind that an individual may fit in more than one category. So we sent out, for example, vaccination teams to the homes of our homebound veterans so that they could get vaccinated, as well as their spouses and caregivers. We have done public service announcements featuring our Black veterans who receive vaccinations, and then using those to inform others in the community. I have personally been involved in Black civic organizations where we've increased awareness around COVID vaccine and discussed the myths and the facts around the vaccine, and educated each other about the vaccine itself. June this month is LGBTQ Pride Month. And so there has been a lot of outreach specifically to this community this month. And we have a health fair that's coming up on June 25th, and we'll obviously be offering the vaccine at that time as well. One of our biggest challenges is our rural veterans, creating opportunities for them to get vaccinated locally, and most importantly, creating safe spaces for open dialogue about the vaccine perspectives, and ensuring that they have the right facts so they can make the decisions for themselves. And so, as I mentioned before, we have trained providers and nurses, pharmacists, et cetera, in those local clinics to provide those vaccines. And that is being done and has been very successful in our 7 smaller clinics. And we're actually about to launch a public service announcement, another PSA, that features the local nurses and physicians in that community, because obviously they're the trusted voices in their community. Another population that is amongst the most vulnerable and hard to reach is our homeless. And so we have a homeless team that goes out into the community, to the shelters. They partner with agencies such as HUD-VASH, and that has been tremendously successful as well. And then the last group is our women veterans. And this is one of our largest, our fastest growing population. About 10% of our veterans nationally are women veterans. And in Birmingham, we have close to 9,000 women. So definitely has been a focus for us. I think somebody has already mentioned about some of the challenges that our women face. This is something that they have to consider not just for themselves, but potentially having the discussion about what this means for their fertility, what this means for passing on genetic mutations to their offspring. And so those are the kinds of conversations and challenges that we need to have, and to disassemble some of the myths that are in our community. And so we hosted a COVID-19 chit chat for maternity veterans and women of reproductive age, where we had a group of experts that came to really listen, to engage, to discuss. And you mentioned before, Dr. Nunez-Smith, about acknowledging the fears, especially of Black and Brown Americans, because of historical injustices. And those historical injustices have been reinforced by sometimes daily discrimination and microaggressions. And so, we have to be respectful of that and know that, this is a reality of a large segment of our population. And coming from that framework, engaging in a conversation, really opening up the dialogue and listening to people. And then they will in turn listen to you and to listen to the facts that you have to share with them, and be able to consider that in their decision making. So I am really happy and reassured that there are clinical professionals like you that have been at the forefront of this, because I know that part of your career has always been about equity and dismantling structural barriers that Black and Brown people have to cancer screenings, to diabetes, to other diseases other than COVID. And I think that when you frame this as creating equity and access to healthcare and not just one disease entity, then people are more likely to engage with you because they believe that you're truly concerned about them and not just about the disease. So thank you.
Yes, thank you so much, Dr. Rodney. Just terrific all around, the multi-pronged approach, fabulous insights there. I just cannot underscore what you said just now enough, that people are looking to know that we are all committed and interested in their health holistically beyond COVID and just the vaccine. And that's so key in equity. So you're doing just so much, and it really is inspiring. It's made me very hopeful, very optimistic. You take a stance of respect, intentionality, and urgency, and you're making substantial progress there in Birmingham. And we together can, right, on vaccination equity, but certainly on health equity more broadly, to your point. I'm so grateful to have been in conversation with you today. Just appreciate you and everything you're doing. Thank you so much. And so with that, I will pause on our conversation and pass the baton on to my tremendous colleague, Dr. Bishara Shuker. Bishara, please.
Thank you so much, Dr. Nunez-Smith. And for primary care providers to actually vaccinate in their offices, it takes collaboration between the healthcare system and the health department. So I'm really thrilled to have the last two panelists here with us today, Dr. Angela Marshall, who runs a comprehensive women's health practice in Silver Spring, Maryland, and Dr. Bruce Vanderhoff, who's the Chief Medical Officer at the Ohio Department of Health. And Angela, I'm gonna just start with you right away. I had the opportunity to go visit with you in your office, got to talk to your staff, and you have been part of this Maryland primary care vaccine effort that has 375 practices that are vaccinating in their offices. So just tell me a little bit about your outreach effort and how you've engaged with your patients who haven't been vaccinated, and what kind of results have you been seeing?
Well, first, let me say how proud I am of the state of Maryland for trailblazing in the healthcare space. A few years ago, Maryland piloted a statewide primary care program that's been hugely successful at organizing all of our primary care resources so that we can better care for our patients. And as we all know, the pandemic created such an incredible strain on our healthcare system. But because this infrastructure was already in place, we were able to organize and mobilize more effectively. And when we realized that there were significant disparities in our vaccination rates for certain populations, we were able to utilize the state program to open additional avenues for vaccinations, which were the primary care offices. And this strategy proved to be extremely helpful for our patients, particularly those who are unable to access vaccines at the retail sites or at the mass vaccination sites. And it was especially helpful for those who are hesitant to get vaccinated. And most importantly, one of the things that we discovered very quickly was that many patients, not surprisingly, felt more comfortable getting vaccinated in their medical homes, which are often the primary care offices. And so with this program, since its inception on March 15th, there have been more than 110,000 patients vaccinated in the primary care offices within the state, which helped to significantly augment the other mass vaccination efforts that are ongoing in the state.
That is so wonderful. And my understanding from that visit is you literally get a list of patients who haven't been vaccinated yet. Your staff or yourself pick up the phone and talk to them. Maybe in 1 minute, what kind of advice do you have for physicians who are on this, watching this right now, who are interested in doing this type of outreach?
Well, at the start of our efforts, we really tried to tailor all of our outreach efforts to our patient needs. And for example, many of our seniors had expressed frustration with some of the web-based sign-up links that required quick action and sometimes expired before they could act on them. So instead of using a web-based strategy, we called our patients, and some of those calls were done by live people in our office, and some were done by recorded messages that were essentially robocall. And I'm happy to say that our efforts seem to have paid off. As of yesterday, 72% of our patients have received their first dose of their COVID vaccines, and 66% have received a second dose. And for our African American patients, we've had 69% receive their first dose and 63% receive their second dose, which I think is a great start.
That is just so wonderful. Thank you, Angela. Bruce, the Ohio Department of Health has actually taken a few steps to make it easy to actually provide vaccines to providers' offices. What are like the 2 or 3 steps that the health department in Ohio taken to make it easy to get the vaccines to doctors' offices?
Well, I think we recognized that much of what was needed to achieve rapid, high-volume vaccine delivery in large vaccine clinics had actually become an impediment to vaccine delivery in primary care. So we took a number of steps that were really aimed at supporting our primary care providers. First, we're using a highly specialized distribution center to deliver vaccine to primary care practices in packages of as few as 30 doses. As I'm sure many of you are aware, the vaccine actually arrives from the manufacturer in packages of over 1,100 or more recently 450. But 30 doses is a more practical shipment size for many primary care providers. We can now deliver these smaller packages same day, and we're transitioning the order process directly to the primary care offices rather than going through perhaps a health department. So providers can better manage their supply based on their own demand. Secondly, we're realigning our provider requirements to better support primary care, recognizing that continuity care is different than care at a mass vac site. So providers can now offer vaccines routinely in their practices without the expectation of rapid administration. You know, previously we required everyone to begin administration within 24 hours of receipt and then to give every dose within 7 days. Our providers are also being urged to never miss an opportunity to vaccinate, even if it means some doses won't get used. So the bottom line is we want and we need to support our primary care providers in their efforts to get vaccines to more Ohioans. And these are just some important steps in that effort.
Yeah, thank you for bringing the issue of the importance of focusing on not missing an opportunity to vaccinate a patient when they're there in your office. I know the wastage issue has been a concern because we were at the time where we all want to make sure we're leveraging every dose possible, and we need to continue to do that, but we don't want to do that at the expense of providing the opportunity for one of our patients to be able to get vaccinated. Last question to you, Dr. Vanderhoff. What advice do you have for other state or local health departments to be engaged in this type of efforts to make vaccines available at primary care doctors' offices?
Well, based on our experience, I'd offer the following ideas. First, engage primary care providers from the start. They know firsthand what the challenges and opportunities are with vaccination in their practices. And even well-intentioned efforts to support them will fall flat if they aren't part of that planning. Secondly, I think once you engage them, you need to be willing to really listen to them. We had a number of assumptions about vaccine delivery based on our experience with large vaccination sites that posed a real problem for primary care practices. And we had to be willing to really accept some constructive criticism and take a hard look at what we could do differently to support primary care. And finally, I think it's important to have a can-do attitude that assumes responsibility for addressing obstacles, even if it feels like those might be beyond your control. We had to just get past our frustration that manufacturers weren't shipping vaccine in the quantities we wanted before we could innovate our state warehouse solution. It wasn't easy, but our willingness to own the solution led to real innovation, of which now I think we're very proud, and to some real enhancement in the delivery of care in Ohio.
Thank you to you both. I mean, this is the type of practical examples of things we need to do to be able to make vaccines more and more conveniently available to people through our primary care provider offices. Obviously, we are at a point now in our vaccination effort where it's all about the ground game. It is about going community by community, zip code by zip code, census tract by census tract. It's about understanding the type of strategies that would make a difference so that those folks who still have questions about the vaccines have their questions answered, and then they can build their confidence, they can make an informed decision to be able to get vaccinated. And I can't thank you enough for all the work, everybody who's watching, everybody who's participated, about the significant role that primary care providers and health systems have to play in this effort. So my call to action here, if you're a primary care provider who's already vaccinating in your offices, thank you, thank you, thank you. If you're not vaccinating in your office, please take a moment. CDC offers all the resources and toolkits to support you to sign up to become vaccinators. So please check that out and get engaged and be a vaccinator. Also, please take a moment. We have a sense of urgency here to pick up the phone, talk to your patients, send them text messages, emails, letters for those who haven't been vaccinated. And as we've heard from all of our panelists, that one-on-one conversations make a huge difference. So please take a moment to do that. And also make sure you're very vocal about educating not just your patients, but your community. Be engaged on social media and regular local interviews. All of that would make a difference. And let's not forget that we continue to encourage our colleagues and our own practices to get vaccinated if they have not been vaccinated. So I want to take a moment to thank all of our participants today, the panelists, Dr. Fauci, Dr. Walensky, Dr. Murthy, Dr. Nunez-Smith, all the audience today for everything you've done and for everything we will all continue to do to get more and more people vaccinated by July 4th. So thank you so much and have a great rest of the day.